Alrighty, we're going to do a little bit of logistics here. At this point, I'm going to ask my colleague Chris Odo, Executive Director of Delaware Nurses Association, to the podium, and he'll be introducing our lunchtime speaker.
Good afternoon now. Yes, Chris Otto, Executive Director, Delaware Nurses Association. Also stood up registered nurse, also stood up business leader, also stood up on the healthcare workforce subcommittee. So like many of us in this room wear many different hats. I have the distinct pleasure of introducing our afternoon keynote speaker. Her research and work permeates all aspects of not just the nursing profession from which she hails, but the entire healthcare sector. She is internationally recognized, and it is just a blessing to have her here in the great first state. So Dr. Bernadette Melnyk serves as Vice President for Health Promotion and Chief Wellness Officer at the Ohio State University. This was the first institution of higher learning in the nation that adopted the Chief Wellness Officer position, and she also serves as the Helene Fuld Health Trust Professor of Evidence-Based Practice in the College of Nursing and Professor of Pediatrics and Psychiatry in the College of Medicine. She is also founder of the Helene Fuld Health Trust National Institute for Evidence-Based Practice in Nursing and Healthcare. Dr. Melnyk is recognized globally for her expertise, leadership, and innovation in evidence-based practice, child and adolescent mental health, clinician well-being, entrepreneurship, and intervention research, as well as her innovative approaches to population health and well-being. She is the editor of 7 books focused on EBP, child and adolescent mental health, intervention research, evidence-based health assessment, and leadership, innovation, and entrepreneurship. Dr. Melnyk has more than 580 publications and over $36 million of sponsored funding from the NIH, AHRQ, and several foundations as a principal investigator. She is an elected fellow of the American Academy of Nursing, which has also recognized her 3 times as an Edge Runner, a fellow in the National Academy of Medicine, National Academies of Practice, and the American Association of Nurse Practitioners. Dr. Melnyk served a 4-year term on the United States Preventative Services Task Force, the National Advisory Council for the National Institute of Nursing Research, and the Behavioral Health Standing Committee of the National Quality Forum. Dr. Melnyk currently serves as an elected board member and vice chair of the National Forum for Heart Disease and Stroke Prevention, and received an honorary Doctor of Science degree from the State University of New York in 2022. Dr. Melnyk is editor-in-chief of Sigma's top-ranked journal, Worldviews on Evidence-Based Nursing. She was appointed to the National Academy of Medicine's Action Collaborative on Clinician Wellbeing and Resilience in 2017, on which she continues to still serve on the advisory board for ANA's Healthy Nurse, Healthy Nation initiative, and is the founder and current president of the National Consortium for Building Healthy Academic Communities. She received her Bachelor of Science in Nursing from West Virginia University, her Master of Science in Nursing degree and Pediatric Nurse Practitioner Education from the University of Pittsburgh. Had a little fun Pittsburgh and Ohio State conversation earlier, and her PhD in Clinical Research and Psychiatric Nurse Practitioner Education from the University of Rochester. Please help me welcome and introduce Dr. Melnyk.
I am so excited to be here, especially after seeing what's happening statewide here in Delaware. How many of you are excited about your future? Even if you're not excited, can you please act excited for me? I want to disclose my conflicts before I begin. I have a couple of companies that disseminate my evidence-based cognitive behavior skills building programs that are now being used in all 50 states with reimbursement. Starting with a dose of vitamin G for gratitude. I want to thank each and every one of you today for all you are doing in this state. What you do, no matter what you do, is valued and appreciated. Vitamin G is one of the simplest evidence-based practices that if we do it daily, we're going to experience all of these fabulous outcomes. So give and take a dose of vitamin G every single day. I want to tell you a little bit of my personal story. Then you're going to understand why I'm so passionate about wellness and prevention. I grew up in a small little coal mining town an hour south of Pittsburgh, right on the West Virginia border. My dad was a coal miner. We lived in half of a company house. The whole house was about 900 square feet. We struggled financially, but I was born with rose-colored glasses on, and I still can make lemonade out of lemons any day. But my whole world shattered when I was 15. I was home alone with my mother when she sneezed, stroked out, and dropped dead right in front of me. You can imagine what I experienced as a teenager. I suffered from terrible post-traumatic stress disorder, depression, anxiety, and after 4 months of not sleeping because I'd have nightmares, I would jump anytime somebody sneezed. I wasn't doing well in school. My cousin takes me to my family provider, doc, and says, do something to help burn. Sadly, that provider did what so many do today in 2024. First line, got out the prescription pad, wrote a script for Valium, said give Bern one of these every night, she'll sleep, she'll be just fine. There was no mental health help for me in my little rural coal mining town. No evidence-based cognitive behavior therapy, which we know is the gold standard first-line treatment that works for depression and anxiety. Yet, fewer than 50% of children and teens and our college students today do not get it because of the shortage of mental health professionals that exists. But you know the story. What doesn't break us only makes us stronger. And as a result of what I experienced during my teen years, I became passionate to become a nurse, then a pediatric nurse practitioner, a Psychiatry, and go on and get my PhD so I could fill a gap for children, teens, and young adults suffering from depression and anxiety. I will tell you, it's such a blessing to stand before you today and say a program that I developed almost 30 years ago, that I've got 28 studies to back its outcomes, is being used in every single state, including Delaware. Now, for the saddest part of my mom's story, she had a history of headaches for over a year. My dad kept saying, "Go to the doctor, figure out what's wrong." She went to her family doc 1 week before she died. Her diagnosis, high blood pressure. Given a prescription for a blood pressure medication that my dad found in her purse after she died. But think about this, 60% of people in Delaware and the rest of this country have a chronic disease. But what's so sad is that 80% of chronic disease is totally preventable with just a few healthy lifestyle behavior changes. But behavior change is what I call character building. Most people don't change unless crisis happens or their emotions are raised. Half of the people here in Delaware and the rest of the country who have high blood pressure do not have it under control. And we know high blood pressure, the major risk factor for a heart attack and stroke. Well, how'd I get to Ohio State? I was dean actually at ASU with Kathy Matt, who was a great leader there. We were reminiscing some back there at lunch. But I was dean of the College of Nursing and Health Innovation there when I get a call from the chair of the search committee at Ohio State. And Carol said, "Bern, we've watched how you've exploded that college in Phoenix. We want you to come to Ohio State and do the same thing." I said, "I'm so humbled you thought of me, but I have no intention of leaving sunny Arizona and moving to Columbus, Ohio." But, and here's, I want to encourage you with this story. I had been studying corporate wellness for 3 years while at ASU. I saw that the C-suite of big corporations were hiring chief wellness officers, chief health officers, because they knew how important it was for their employees to be happy, healthy, and engaged. But when I went to look for a CWO at a university in the country, there was not one to be found. So I pitched that dream. I said, I'm really not interested in making a lateral move, but if there was an opportunity to combine the dean's job with the university-wide leadership role as the first chief wellness officer at a university in the country, I might talk to you guys. I'm not kidding you. The next day, E. Gordon Gee, who was our president then, who is president now at West Virginia University, my alum school, called me. And here's how the conversation went. Melnyk, this is E. Gordon Gee from the Ohio State University. This is how he talks. What the Sam Hill is a chief wellness officer, and what would you do for Ohio State value add to what we've already got going on? Come and talk to me. That's how I got to Ohio State. You have a lot of open positions to fill here. You gotta recruit like wildfire. Never assume somebody won't move. And you look for happy people who say, I don't want to move. I'm not going to move. It's possible. But then you have got to retain them. And the way you do that, multiple mechanisms, but something so key. You got to build a culture of well-being. I'm going to talk about what we've done at Ohio State that has led to better outcomes than the rest of the country is experiencing right now. But culture eats strategy for breakfast, lunch, and dinner. You got to make healthy behaviors the norm. Easy and fun for people. There's no sin to having fun at work, truly. There isn't. Well, my formula for how we're going to reach the quintuple aim in healthcare, evidence-based practice in the DNA. We spend more money on healthcare than any Western world country, but we rank in the bottom for our population health outcomes. Why? A couple of big reasons. Because well-meaning, caring clinicians are suffering from burnout, making preventable medical errors, which are now the third leading cause of death in this country. The other reason that's big, because we've always done it that way. Not using the best evidence to improve clinical care. And I have so many examples, because that's one of my areas of passion too, is the evidence-based practice. But without EBP, without clinician well-being, and without advancing health equity, we're not going to get there. And it's going to take us another 100 years to make the kind of progress that's needed. Our clinicians are in the terrible twos right now. Too much stress, too much work, too many tasks, too little time, they think, for self-care. In 2017, the National Academy of Medicine said, we've got a public health epidemic, clinician burnout, depression, suicide. So what they decided to do was to create this action collaborative for clinician well-being. I was so blessed to be asked to participate as one of 60 leaders on that action collaborative. We are still working on this hard to this day. If you haven't seen our website that's on the slide, I'd encourage you, go to that website. We have put up so many fabulous resources, evidence-based tools, and models that you can draw from for your workplace. We launched our action plan, priority areas. And the first one is about culture. But here's the character builder with culture. The average healthcare administrator, chief nurse exec, they're only in place now for 3 years. It takes longer to truly bend a culture, 5 to 10 years. And once a leader leaves, even if things were moving in a great direction and a new leader comes in, they may have total different priorities. We gotta keep banging the drum. We've gotta keep creating these fabulous cultures for both our learners as well as our workforce. We had these issues prior to the COVID-19 pandemic, but here's what's gonna happen in the next 3, 4, 5 years because of COVID. During COVID, people were stressed. They were coping with unhealthy behaviors. During COVID, we saw unhealthy eating went up. In fact, the national studies that show weight gain in Americans during the pandemic, the average weight gain in those studies, 29 pounds. Now, what's that gonna lead to 3 years from now? More diabetes, more high blood pressure, and physical activity went down, alcohol use and drug use went up as people attempted to cope. Clinician suicides went up. These are some of the beautiful faces of nurses and a wonderful physician, Dr. Lorna Breen, who was director of an emergency department in New York. She was struggling so bad because of the pandemic that she got really depressed, admitted herself to a psychiatric unit. A couple days after she got released, she killed herself. No warning signs at all in her history. The reason, because she was afraid. She was afraid she was gonna lose her license. What came out of that, though, and I am good friends and colleagues with her brother-in-law, Corey Feist. He and her sister started the Lorna Breen Heroes Foundation. And We had legislation that passed that gave millions of dollars to healthcare institutions to improve this situation. As a result, the foundation that Corey leads now is booming. Well, I saw an article published in JAMA about the number of states that still ask inappropriate mental health questions for physicians. When I saw that publication, I said, I gotta look to see whether we've ever done this for nursing. No data was available on that. So I said, I've got to do this. Team, we've got to do this. So it took us 8 months to get the applications from nursing boards to see whether or not they were asking inappropriate mental health questions that are putting up barriers for nurses to get help if they need it. So I called Corey. I said, do you want to do this audit of these state board applications with me? He said, absolutely, let's do it. Guess what? 37 states were still asking inappropriate mental health questions. I have been banging the drum like crazy to the National Council of State Boards of Nursing to say, you've got to help me. Let's get more pressure on these states. Let's get these questions removed. See, the states think they're protecting the public by asking those questions, but what they're doing is deterring health professionals from getting mental health help. So since we published our findings, we've had 5 states remove those mental health questions. And Corey and I are determined in the next 2 years, let's make it that no state in this country ever asks these inappropriate questions again. So what have we learned? I've done a lot of studies, national studies, not only with nurses, but with pharmacists, with physicians, with optometrists. And what we see in all of these studies, burnout in our workforce, you saw that this morning. With physicians, it's gone down a bit. We have not, to my knowledge, seen it go down in the nursing profession. Burnout is strongly correlated with depression and anxiety. Depression and suicide in the healthcare workforce is higher than the general population. We've got to be screening and getting help to the people who need help. And the communication has got to be this. It is a strength to recognize when we need help. It's not a weakness. And when you see somebody struggling, you can ask just 4 little words. Are you okay today? Because those 4 little words open up a window of opportunity for somebody to say, no, I'm not okay today. And for you to say, it's okay not to be okay sometimes. But do you know these resources exist to help? We've got to make sure Everybody knows that 988, Suicide and Crisis Prevention Hotline. I was doing the happy dance when we went from 1-800-273-TALK to 988 because people can call that hotline 24 hours a day, 7 days a week for confidential mental health help. Well, what else do we know from not only my studies, but other studies? The longer the shift work, the higher the burnout, depression, and the more medical errors that are made. Medical errors are now the third leading cause of death in this country. Think about that. Behind cardiovascular disease and cancer. 250,000 people lose their lives every single year, probably more, in the United States from preventable medical errors. I almost lost my youngest daughter in Australia. I was telling Kate this because she was born there. Due to a ruptured appendix that I had diagnosed as a seasoned NP, but nobody would listen to me. It was one preventable error after another. But getting back to this, we gotta stop 12-hour shifts. We can't wait another 25 years to do that. Do you know the C-suites across America gasp when I say that? And they say, Bern, no way would we do that, because nurses will jump ship. They love 12-hour shifts. I say nurses are smart. If you give them this data and you explain why you're doing this, not only for their benefit, but to reduce patient error and harm, they'll be okay. They'll deal with it. I only know of 2 chief nurses that I have presented this data to that have said we're stopping the 12-hour shifts. The other thing my work is showing, there are 2 major variables that impact burnout, depression, stress, and anxiety. Mattering. Think about this. How much do you believe you matter to your workplace right now? When was the last time you were told that you matter? There are so many clinicians out there right now across the country, they don't get regular doses of appreciation and vitamin G. People will often stay once they know they're appreciated and valued and recognized for what they do, more than they will stay for money. So how much are you, if you're a leader, integrating vitamin G, mattering into your team, into your organization? And then sadly, the majority of clinicians, they do not engage in evidence-based recommendations for physical activity, healthy eating, sleep. And if we don't walk the talk, who's gonna follow us? Our students aren't gonna do it, and I have so much data that shows the unhealthy behaviors we have in faculty as well as in students. So I just want to show you a little bit of data from 2 hot-off-the-press studies our team did. We surveyed chief nurses, 115 of them across the United States, and nurse managers throughout the state of Florida. Nurse managers had a burnout rate of 54%. The chief nurses, 46%. 30% of our nurse managers met the cutoff for clinical anxiety. 15% met the cutoff for depression. But sadly, they were doing such little healthy lifestyle behaviors. But the other thing we showed, again, in this study, if people believe they mattered to their organization and they believed their work site supported their well-being, they had much less burnout, depression, stress, and anxiety. Well, how many of you are parents? Most of this room. Think about what you experienced during COVID, what you still continue to experience. And one of my wonderful faculty colleagues walked in my office during COVID one day and said, "Bern, I'm totally burnt out from parenting combined with my work situation. I don't think I could do this much longer." I said, "Kate, what do you want to do?" She said, "Let's create a parent burnout scale." She said, "I have a DNP. I'm not a heavy-duty researcher like you, but we can do this together." I said, "Kate, there's 2 scales that exist that I know of, but let's check to see if there are any working parent burnout scales." We checked, we couldn't find any, so that's what we developed. We did a study, we found out 2/3 of 1,200 parents met severe cutoff levels for parent burnout. I asked my senior director of marketing and communication, "Can you contact Good Morning America and the Today Show and see if one of them would be interested in our story?" The Today Show jumped all over it. They sent a camera crew to Ohio State and filmed me and Kate for 6 hours. We ended up with a 6-minute spot on the Today Show. But what was great that came out of it, they put our scale up on their website and our report that has a lot of great evidence-based recommendations in it. So it's on the slide. Please share it with parents in your organization.
It's a daily
They will benefit from taking the screen and hopefully reading what they can do about it. We know the consequences of burnout, both for clinicians as well as our healthcare quality and safety. But here's what sounds good to the C-suite when I share this. If you invest in wellness for your people, you're going to get a positive return on investment. At Ohio State, we calculate this every 2 years. Our ROI has ranged between $2 and $3.65. We save our university and big Wexner Medical Center, millions and millions of dollars every single year. Now, here's what's happening to CWO positions. There are about 100 of us now at universities and hospitals and health systems, because I'm in a network of CWOs. I get a lot of calls from newly hired CWOs that want to pick my brain about strategy, which I'm happy to do. But I ask them, what resources did you get from your leader or administration? Well, what do you mean, Bern? What kind of team did you get? What materials, what resources did you get? I will tell you, 98% of them said, I didn't get anything, I got the title at 50% time. So a lot of places are checking off a box now. We have a CWO. In 10 more years, we're going to triple, because so many university presidents and provosts also are considering appointing a chief wellness officer. But I wish these folks would call me while they're negotiating, not after, because you're not going to be able to do much with a 50% CWO appointment and no wellness team to assist you. We've gone from ROI to value of investment. So that means we look at other things beyond cost, like turnover, engagement, presenteeism, improve patient satisfaction, because if the clinicians are happier, healthy, and engaged, their patients are going to be too. I wanted to show you this recent systematic review. One of the problems we have to do meta-analysis type of systematic review, everybody measures ROI differently. So as a result of that, we don't have enough data to do a meta-analysis. But this systematic review looked at 26 papers that were conducted in healthcare and included clinicians. And what they found is the ROI was positive in 56% of the studies that were done. So again, you've got to make the case with evidence. Investing in wellness does typically work. It increases ROI and VOI. And if you're a leader for a system, an academic institution, I really want you to think about 3 major constructs that lead to improvement. One, you've got to offer evidence-based wellness programming to your people. Nurses don't want to hear anymore, I don't need to be more resilient. I am resilient. But I do tell them resiliency, we know with data, is a huge protective factor against both physical and mental health conditions. Do you know and practice cognitive behavior skills building? Because it works. Do you know and practice mindfulness? Are you integrating those programs into required curricula? I was asked to speak to about 160 university presidents a few years ago. They were calling APLU's CEO saying, we're going crazy. Mental health conditions are rising like wildfire. We're hiring more mental health counselors, but we're not moving the needle. What do? I offered evidence-based solutions, but I said this to that group of presidents. This can't be optional anymore. This is not a nicety. It's a necessity. And you gotta figure out how to integrate these evidence-based programs that we know work into your curricula. Because bottom line, medical students, we have 7 health sciences colleges at Ohio State. The students typically are overwhelmed with their core coursework. Even if you offer fabulous evidence-based wellness programs to them, they're gonna say, I don't have time because I'm overloaded with regular coursework. And I say to the deans, what are you still teaching that's nice to know versus need to know? And take the nice to know, the zebras that people hardly ever see and encounter, take those things out and instead give your students the life skills, the resiliency building skills that we know they need to deal with stressors throughout their life. We gotta remember 2/3 of college students who aren't there anymore leave due to a mental health condition. So we really got to figure out how to do that. We have to target organizational interventions, system interventions focused on things that are broken, that cause a lot of burnout, like bureaucratic processes, problems with the electronic health record, our informatics and our clinical people, they've got to figure this out. Because if you have to give 12 clicks in the EHR to give a flu shot, there is a problem. There is. And then lastly, we absolutely got to focus on culture. And that's not an easy lift. It really isn't. But you've got to be persistent. This has got to be in the DNA of the organization. So, being that I've been banging the drum for evidence-based practice since the late 90s, in 2000, a paper came out from Bayliss and Boren that said, it takes 17 years to translate findings from research in the clinical practice to improve care. We joked about that. That's 17 years if you're lucky, sincerely. Then in 2021, a group of colleagues, Kahn and colleagues, they did a study. They got so happy about the findings. They said it only takes 15 years now, on average, to translate evidence-based things that we know work in the practice. Well, at that rate, it's only going to take us 150 more years between research, high-quality research coming out, and it being quickly translated into practice. Honestly, The gap between what we know and what we do is lethal. I go to the Hill quite regularly. My legislators know me quite well to advocate for things that I really believe need changed in our state. One of my recent conversations with one congresswoman that I love very much so, she said, "Bern," when she saw me coming, "don't ask for more money. I don't have more money to give you. I had a solution for you. I'm not gonna, what's your solution, Bern? Instead of continuing to pour money into non-evidence-based things, let's de-implement them, and then we'd have the money." Do you know what her response was to me, sincerely? "Bern, it's a good idea. Don't get me wrong. But our legislators, you got to realize, some of them have pet programs that they have been passionate about for decades, and they are not going to be willing to change that. But I keep banging the drum." So my research team and I, actually part of the National Academy of Medicine's Action Collaborative, we did a systematic review. What interventions work for physicians and for nurses? These 6 things work. There's so much great evidence behind mindfulness, cognitive behavior skills building, having a health coach, vitamin G, visual signs that trigger people at decision points work, and then deep abdominal breathing. That's such a simple technique. But we don't teach that in primary care traditionally. I mean, it's one of the simplest things that we can do to help people who are stressed and anxious. So I mentioned in my conflicts, through the past 28 years of my career, I have created an evidence-based, cognitive behavior therapy-based, manualized intervention that can be delivered by primary care providers who are not psych mental health providers. I call it cognitive behavior skills building. I don't call it CBT, but it is CBT-based. And if you go through the whole program, you can pick out all the key elements of CBT. Well, about 6 years ago, we adapted it for clinicians, nurses, physicians, pharmacists, respiratory therapists. We call it Mind, Body, Strong. We've conducted clinical trials on it with beautiful outcomes. We integrated it into our residency program because, again, we're thinking preventive and early intervention. But last year and a half ago, I was funded by the American Foundation for Suicide Prevention to digitalize this 7-session program, because then we could bring access to anybody in the country with this. We have enrolled 325 nurses from across the country who are at very high risk for suicide. And now we're looking, is this program combined with the AFSP's interactive screening program more efficacious than just the screening program alone? So I hope to have some outcome data from this trial to show sometime in the next 12 months. I don't know if you've ever read Vivek Murthy, our current U.S. Surgeon General's report, Workplace Mental Health and Well-Being. But if you haven't, I'd really encourage you to download it and read it. It's worth your time. But in this particular document, he really talks about the 5 essentials for workplace mental health and well-being. Employees want protection from harm, connection and community, work-life harmony, mattering is so key, and opportunity for growth. Well, as part of the NAM Action Collaborative, as we've worked on multiple things, I want you to be thinking about what stupid stuff can we get rid of. Now think about this. When I was dean of our College of Nursing for 12 years at Ohio State, about 5 years ago, I did a What's the Stupid Stuff survey with my faculty and staff. I asked if you could eliminate a couple of things that we do that aren't dictated by upper leadership here, what could we eliminate? First thing, people said, meetings. Can we get rid of some meetings? I said, sure, I'd love that. So we did no meetings until 11 a.m. on Mondays, because what do people do on the weekends? They try and get caught up with their hundreds of emails that fly in. But if they didn't have meetings till 11 o'clock on Mondays, they could go in and answer them on Monday morning and enjoy their Sundays for a change. And no meetings all day on Fridays. Oh my gosh. I got a person who called me and said, Bern, can we please just make one exception? Our P&T meetings have always been on a Friday. Like, no more meetings on Friday. I can't tell you how much productivity soared once we did that. A latest study just came out. I don't know if you saw it. A decrease in meetings by 40% leads to an increase in productivity by 70%. It's that big. So think about that. I am going to finish this last piece of the presentation today, sharing a little bit of my journey at Ohio State, what's worked, what we did, what you might want to consider because it works. We are a big elephant in our state. We have over 66,000 students, over 46,000 faculty and staff. We have 18 schools and colleges, including 7 health sciences colleges. We also have 7 hospitals. My charge, Bern, as CWO, is to get everybody healthier, happier, and more engaged. It's like a big city that I'm responsible for people's health and well-being. Well, when I got to Ohio State, they were doing a lot of good things. HR was doing some things. We had an online wellness platform. We have our own health plan with some nurses and case managers. Student Life had a wellness center. But nobody ever came together, ever, to talk about what's our vision, what's our mission. And there was no strategic plan for wellness at Ohio State and no structure for it. So that's what I did First thing, I brought every person who had anything to do with health and well-being for faculty, staff, students, and alums together. We created our vision, and we're serious about it, to be the healthiest university and community on the globe. We set 4 major strategic planning goals. You can actually download this strategic plan on my CWO website. It has a lot of other good things there too. I just started a podcast, short podcast that you can share with your people. I created a structure for wellness at the university called the One University Health and Wellness Council. Under this broad council that includes the medical center, we've got 5 sub-councils. They focus on faculty and staff. They focus on the medical center because some of those interventions have to be tailored a little bit differently. They focus on research and outcomes. So those sub-councils meet regularly. They all have a chair. We've got a framework for this. We adopted the socio-ecological framework. We target interventions that are evidence-based to individuals, family and social networks, the culture and environment, as well as policy. And then we have the outcomes that we rigorously measure every single year. I have a philosophy: in God we trust, but everybody else should bring data to the table. And we truly live by that philosophy, because why collect data unless it's going to guide you to intervene, right? That's so important. So we take a multi-component, evidence-based approach. We target evidence-based interventions to individuals in the grassroots, to faculty, supervisors, managers, to top leaders, the system. And we do it all within a culture, getting that into everybody's DNA. You will feel that if you come to Ohio State, seriously. I do rounds to the hospitals. I take a Wellness on Wheels cart with me with healthy snacks in it, right? There's so many things I do, but the last time I visited our East Hospital, my heart was so happy because in every unit, they had a vitamin G board. It was fantastic to see. And then we measure ROI and VOI. Well, you can have the best programs for your people, but if people don't engage in them, if their leaders don't tell them, or their managers, we want you to take 4 hours of your day and go to that special workshop that Melnyk's doing today. Engagement, we know. People who consistently engage, our data shows it, have much better outcomes. When I first got to Ohio State, we were incentivizing everybody with gift cards, like for everything. I'm like, do you know how many millions of dollars we are spending on this? And we don't even know if it's working. So we began to analyze, and we saw this data, and we changed what we were doing. We said, we're going to reward people with gift cards for consistent engagement over time, not for a one-dose something. These are the outcomes we track. So about 6 years ago, Megan Amaya and I developed a valid and reliable wellness and environment culture scale. This is embedded into our annual personal health assessment that our faculty staff complete. We have learned this scale correlates with mental health and physical health outcomes. There's a lot of places that are using this scale now. So if you're interested in seeing that, email me and I can send you the publication. We specifically look at 10 important health and well-being indicators that are responsible for 25% of our healthcare costs. So we get this broken down, this data, by college and by hospital unit. And I go around every summer and I meet with the vice presidents and the deans and their executive teams, and I share with them their data compared to the rest of the university. I can't tell you how successful that strategy has been. Buckeyes are very competitive. So a dean of medicine doesn't like to see the fact they're not scoring as well on their physical activity or their depression as other units. But seriously, giving people back their de-identified anonymous data really works wonders. So these are all evidence-based strategies and lessons learned over the course of the last 13 years of me spearheading health and wellness for a big land-grant university. You've got to first create an exciting dream, a vision. If you can't get your people excited about your vision or your dream, they're not going to have the energy to consistently participate in advancing that dream. How many of you have a chief wellness officer right now in your organization? Great. There's like 5 or 6 of you, 8 of you. Awesome. Everybody needs a leader who is responsible for this, who needs to gather data, who needs to bring the data back to the top leaders with intervention strategies, who needs to say to the president or the CEO of the hospital, we have a problem here, but I've got a solution. That data is powerful. System issues, we got to deal with those that cause burnout. We got to get rid of stupid stuff. We must implement an evidence-based, strategic, multi-component approach. We got to make it easy and fun for people to engage. We got to tell them they matter. Give a dose of vitamin G regularly. We need to include wellness in all onboarding. Anytime we hire anybody, we should be showing them, here's our vision, our mission, this is our strategic plan. You matter, and because you matter, everybody we hire, we invest in wellness at this institution. We need to engage our clinicians. They want to be heard. They want to innovate. They want to be part of solutions. The nurse manager data I showed you. Do you know the average number of direct reports nurse managers have? 50 to 70. They said, Bern, we'd like to be doing wellness checks with our nurses, but are you kidding? I have 60 or I have 70 direct reports. I do nothing but fight fires every single day. A year after I got to Ohio State, I started our Buckeye Wellness Innovator Program. We have over 700 faculty and staff who work with me and my wellness team on creating cultures of well-being in every nook and cranny across their university. This is a high-impact, low-cost program. We strategize with them. We have a structured program for them. We've got Buckeye Paws. We have 32 therapy dogs. It's fabulous. I do rounds in our hospital units with the dogs, and it just melts people's stress away. So I'm going to finish by saying, we need help me with this. We will always need great sick and crisis care. But unless we flip our paradigm from one of sick and crisis care to wellness and prevention, we're not going to move the needle. This country only invests 3% of its spending in wellness and prevention, even though 80% of chronic disease is totally preventable. Now I'm going to finish with a few slides on you. Think about your own healthy lifestyle behaviors, your habits. Don't forget to prioritize you. Good self-care is not a nicety. It is a necessity. This is a one-item valid burnout scale that we embed in our personal health assessment every year. So I can tell you exactly what my burnout rate is in every hospital, in every college at Ohio State. If you are falling, and be honest with yourself, the first step in change is to face your true story and to rewrite a new one. If you're falling in 3, 4, or 5, a red flag should be going off in your head. It really should. You got to do something different. Today is time to do something different. I was working 24/7 during the pandemic at our university, 7 days a week, 14 hours a day. In the middle of the pandemic, I came home. My husband asked me a simple question, and I nearly bit his head off. And that's so unlike my character. I'm a big, warm, and fuzzy. But John, after hearing me for decades, said, "Bern, you're burning out. You got to do what you tell everybody else to do. Face your true story. What are you going to do about this?" I thought for a minute. I said, "I need to take a bucket list trip." He said, "Where do you want to go?" "I want to take our bucket list trip to Tanzania and watch the wildebeest migrate." He said, "During the COVID-19 pandemic," I said, "Yes, it's open Jeep. We will be fine." And the best thing I ever did in my life was take 10 days. I told my teams, I'm not available. I'm not opening my computer. I'm not answering texts. You can handle anything that comes about. But on that trip, I made a commitment. I will never get to the place of responding 3, 4, or 5 again. And you got to remember, technically, cardiovascular disease is the #1 killer. But it's behaviors. When you consider all causes of death and disease, it's these behaviors, including sitting. How many of you sit 3 hours a day on average? Most of this room. Do you know you have a 30% increase of cardiovascular disease because of that sitting? And if you sit 5 hours a day, that's comparable to smoking 1.25 packs of cigarettes on your body. Now, some of you look shocked when I gave you that evidence, but why didn't you all stand up, right? So to finish up, this is all we got to do to prevent the majority of chronic disease. 30 minutes of physical activity, 5 days a week. If you cut your meetings down at 40 or 45 minutes and go on a walk 3 times a day for 10 minutes, you can do that. 5 fruits and veggies a day. Don't smoke. Everybody loves when I talk about alcohol. If you don't drink, don't start. But if you do, limit it to 1 standard drink a day. And then everybody asks, Bern, how big can that drink be? And I tell everybody not the size of the alcoholic beverages we get in Vegas. This is a real fitness facility in the state of California. You have a choice. You can either walk the stairs or take the escalator to go work out. 2 psychologists analyzed how many people for a week chose the steps versus the escalator to go work out at the gym. They're finding 2 people a day. That's it. Find your emotional reason. Find your emotional reason to make a change today, if you need one. Today can be your January what? It really can be. And lastly, people who have big dreams, purpose, passion, they wake up every day, they spring out of bed, they say, I'm so excited to go to work today. When we are not aligned with our dreams, our purpose, our passion, that's when we lack energy. We're demotivated. So if I could be your fairy god person standing before you today, in the next 5 years, what are you going to do personally and collaboratively in this state if you know you cannot fail? What are you going to do? Most people can't answer that question right away because they've lost their dreams. Put your dreams back on the front burner again. A study with seniors, it's found seniors didn't regret what they did in their life. They regretted what they didn't do. So if you've buried some dreams, now's the time. Get them back on the front burner. I have 3 Ds to success. The ability to dream big, discover, which is all about risk-taking and innovating, and then lastly, deliver. Persist through the character builders until your dreams come to fruition. There are days I wake up, I might not feel like taking my character building dogs on their 2-mile walk run, but I do it anyway because I know I'm going to feel better later. But why do I do it? I do it for these beautiful faces. My 3 daughters, my husband, and my little grandchildren, because I want to be around for a long time. We have an awesome summit on clinician well-being coming up in October in Columbus, Ohio. Would love to see some of you for that. And I'd encourage you, check out our national consortium for building healthy academics. By the way, I want you to join my 155 Eye-Opener Challenge for the next 30 to 66 days. That's how long it takes to make a new habit. Get up, practice 1 minute of gratitude, 5 minutes of reading in a positive or inspirational book or listening to a positive cast, and 5 minutes of movement, physical activity. You're worth these 11 minutes every day. And to finish, if I could motivate you enough, this little girl will.
Just